Hello, welcome back. I'm going to finish this lecture with the standard setting organizations and then the professional organizations. So, as you might expect, the standard setting organizations, AHRQ and NQF, have similar missions, and that's in part due to the fact that they have similar support. AHRQ is an organization of the federal government. NQF is a nonprofit organization funded by primarily the DHHS, Department of Health and Human Services, federal government entities. So they have very similar backgrounds. Probably a lot of people from AHRQ went to NQF and etc. Now, they do have somewhat different methods for reaching their goals, and I'll tell you that AHRQ's stated mission is to improve the quality, safety, efficiency, and effectiveness of healthcare for all Americans, heady goal, through research and dissemination of findings. You'll note, however, that the link I gave you doesn't take you there. In fact, it takes you to the mission statement for a center within AHRQ called the Center for Quality Improvement and Patient Safety. This center's mission is somewhat more specific and germane to the course topics, so that's why I picked it. They include conducting, supporting, reporting, and disseminating user-driven patient safety research with a focus on quality management, quality reporting, and quality improvement. This mission adds collaboration to accelerate implementation of evidence-based practice and assessing practice to ensure overall quality improvement for the center itself as well as for those it serves. So this center within AHRQ is really focused on collaborating to get to the goals. Excuse me. The NQF, their overall mission is to support U.S. healthcare quality by forming partnerships to build consensus and work toward national priorities and goals for performance improvement, endorse national consensus standards to measure and report performance, and to use education and outreach as a vehicle for attaining those goals. NQF plans to do this by establishing national healthcare priorities with input from leaders of public and private healthcare enterprises and ultimately becoming a major driving force for and facilitator of continuous quality improvement of American healthcare quality. The overall role of these two organizations is to support and conduct research that leads to improved quality and then to set standards for quality based on findings from that research. So basically it comes down to here's what we think we need based on research, and then they will set those standards. Now, here's the feedback loop, is that these pieces of research are conducted and they are implemented as findings into evidence-based practice. That evidence-based practice becomes the standard by which organizations are held, or to which organizations are held, and they're fed into the accreditation organizations. The accreditation organizations build this into the floor of being accredited as producing at least minimal quality care. And that is really how the government ends up being able to regulate it, is the standard setting organizations say, here's the standard. The accrediting organizations say, you have to meet this standard. And the regulators say, if you've met this standard, then we'll pay you. Or, in the case of like CMS, who actually pays directly to insurance companies or to providers for giving quality care. And ultimately, under PPACA, the standards are set for exceptional care under pay-for-performance. So then there are the professional organizations, which have as their primary role really advocacy and then building under that evidence-based practice, and you'll see how that works. The professional organizations are too numerous to count. Every specialty and subspecialty, from med-surg to neurosurgery and all points in between, for all manner of providers, from nurses to physicians to social workers and etc., have some kind of a specialty professional organization. To simplify things, I'm focusing on the two big ones, and that's the American Nurses Association and the American Medical Association. The American Nurses Association and the American Medical Association do, by definition, speak for all nurses and all physicians, whether those nurses or physicians are members or whether they are not. So keep that in mind. In the case of AMA, and I'm not sure of this number, I think it's like 48, something like that, % of physicians are AMA members. I am relatively sure of this number, that 13% of all nurses are ANA members. Now, if you think about it, these organizations speak for every nurse, whether that nurse is a member, every physician, whether that physician is a member. It behooves you to be a member of the organization, particularly if you disagree with the organization, because your disagreement will not be noted unless you're a member and you make that disagreement known. So, let me kick my soapbox away. The American Nurses Association's mission statement is the model of simplicity. It says, nurses advancing our profession to improve health for all. It just doesn't get any simpler than that. But to understand what ANA means by this, you have to look at their statement of purpose. And from this, you'll find advocacy is a central role of the organization, as I said before. In addition to the advocacy role, though, ANA adds considerably to healthcare quality through such initiatives as the American Nurses Credentialing Center, which provides credentials for all manner of nursing specialties and expertise, including magnet hospitals, certain nurse practitioner specialties, certain nursing specialties, and etc. They also have the National Database on Nursing Quality Indicators, the NDNQI, and that monitors nursing care using a combination of structure, process, and outcome indicators. And these indicators include such things as nurse-to-patient ratios, medication administration processes, the occurrence of never events. And never events are just that. They're events that should never occur with excellent care, such as pressure ulcers. And they also have other things that they monitor. We'll go into much more detail on never events in a later lecture. Now, the AMA statement is similarly very simple: to promote the art and science of medicine and the betterment of public health through leadership, excellence, integrity, and ethical behavior. The link from the lecture, like you're going to get used to from me, doesn't go directly to the AMA mission. Instead, it goes to the Council on Science and Public Health mission, which is part of the AMA. And again, that's because it's more germane to quality management. The CSAPH mission is to make the AMA the leading organization in advancing medical science, which will improve patient care quality and public health through promoting science, public health, quality, advocacy, and prioritization of public health. So reviewing these missions from these 6 organizations, a quality manager can determine that she's got a great deal of support in identifying quality benchmarks, recognizing gaps in quality, measuring those gaps, identifying mechanisms for narrowing or correcting limitations in quality, implementing corrective actions, managing continued improvement, and advocating for measures necessary to achieve even higher quality. That ends this lecture, and I will go on to Lecture 2 of Module 1 next. Thank you.